Good afternoon or good evening, depending where you're watching us from. Welcome to our second panel during our Healthy Kids Summit. If you missed our first panel earlier today, we talked about vaccines and immunizations. It was a fantastic program, really kind of getting, because we know the past 2.5+ years, we have gotten off track with our kids and our vaccines and immunizations, and that is paramount to their health. And so we talked about what needs to be done, what the challenges were, and we gave you some great resources on how to get your kids back on track. And so this is part two. So this whole day, it's all about healthy kids. School has started back in. We are getting back in the groove of sending our kids back to school and going back to what some parents consider to be germ factories, right? Because they're bringing in all of their germs and stuff from their houses, and we all get back together and mixing up with the kids. It's a lot going on. So we are here to help keep your kids healthy and safe, get them back on track, and add some services that you might not be doing on a regular basis. And that brings us to today. So this panel is all about your teeth. Your child's teeth are the gateway to their health. That's the name of this broadcast. And we're going to tell you why and what they should be doing and give you some resources at the end of the program on how you can connect to dental services if you don't have any already. So before we begin and we get to our guests, a couple of things I need for you to do. Number one is drop where you're watching us from in the comment section. We'd like to know where people are watching us from all over the world. And so please drop that in the comment section. Number two, if you know somebody that needs this information, tag them, share it on your page, get this out there. They've got kids, small children, all the way up to 18, 20 years old. I think you can see a pediatric dentist until you're 20 years old, as long as you're on your parents' insurance. So you can see a pediatric dentist. So please share this on your page. And then finally, if you have any questions, please, we've got two of the best. We've got a celebrity dentist here. We've got a pediatric dentist with us. Please, if you have any questions, drop those in the comments and we will get them asked, because that's the whole purpose of this program, to get your questions asked and get them addressed here today. So I'm going to shut up because y'all didn't sign on to see me. You signed on to see our guests. So I'm going to introduce our two guests that we have here this evening. We've got Dr. Catrice Austin. She is from VIP Smiles. She's got two offices. She's got one in Flint, Michigan, and she's got one in NYC. And so just a little bit of something. Dr. Austin, when y'all see Cardi B smile, that's Dr. Austin. That's all I got to say. That's Dr. Austin. She put that grill together. All right. And then we have Dr. Trudy Ann Frazier. She is in Atlanta. She's in the Atlanta metro area. She works at the pediatric dentistry at Vinings in Smyrna, Georgia. It is a fantastic dentistry. I've been there. I'll take my kids there because I live in the Atlanta metro area. So I can speak directly to what the work that they do at the pediatric dentistry at Vinings. And so great work there. Her and Dr. Bates. Try to give Dr. Bates a shout out as well. So first question, let's just start with the basics. Okay. When's the first time a parent should take their child to the dentist, and what is the purpose of that visit? We'll start with you, Dr. Fraser, since you're the pediatric dentist.
Sure. Thank you, Alice. So, the first time a parent should take their child to the dentist is actually 6 months after the first tooth. So, that first birthday, while you're celebrating, you get the nice cake, the smash cake. Go ahead and call up your local pediatric dentist. We actually start seeing them at age 1. What is the purpose of this visit? So, the purpose of this visit is to establish a dental home. We know that accidents happen. And if you already have a dental home established, you almost without a doubt have an emergency contact for that pediatric dentist. You can call them up even in the midst of the emergency, and we're here to guide you through what to do, what not to do, and even get you scheduled or have you come on in case that child's tooth needs to be addressed ASAP. So number 1, establish your dental home. Number 2, that first visit, we do something called anticipatory guidance. Now, what is that? So, what that is, we help you to anticipate what's to come. So, I'm a proponent, as well as most pediatric dentists, on preventing cavities before they start. So, we talk about the diet, we talk about the habits, because now the kids have teeth. It's going to be different. The feeding is going to be different. The foods that they eat are going to be different. So, our big goal is to help prevent cavities before they start. And the best time to start is early rather than later.
Well, look, anticipatory, that's a big word of the day. So, yeah, so I think people forget, they just think, okay, once I get teeth, that's when I go to the dentist. But it sounds like 6 months, as early as 12 months from birth, you want to kind of take a look at that jawline. You want to kind of make sure, are the teeth going to be coming in properly? Are they aligning up properly? So there's a lot of things that happen even before the child has teeth. And then after that first tooth breaks through, is that eruption? Is that the right word?
Yes. Once the
Okay,
tooth
all right.
erupts. So Ellis, that's 6 months after the first tooth. Most kids get their first teeth at 6 months. So that age one, that birthday, that 1-year-old visit.
Okay. So it's a 1-year-old visit. Yes. So 6 months after the first two, you're right. Because at 6 months, they start having a teeth. You know, when a child is teething, those of us with kids understand that process. It's not fun, but it really is an important process. But it's also important to get your child used to going to the dentist. And that. So how often? So after that first visit, 6 months after the first tooth, how often should they start visiting the dentist as a child?
I'm assuming that question was for me.
Oh yeah, always.
Awesome. So research shows that cavities double in size in 6 months. So I guess we're doing a lot of sixes today, right? So every 6 months, so twice a year is a good standard to visit your dentist, just so you can catch the cavities while they're smaller, as opposed to trying to treat them when they're larger. The larger the cavity, it tends to be more expensive to fix and more invasive the treatment.
Yes.
So, and another question, just as a follow, what happens in a regular dental appointment for a child?
Yeah, great question, Ellis. So, a couple things happen. The dentist does your examination. This is where we look at the growth and development. We look at the jawline. We look to see if you're going to have any crowding. We also check for cavities. And this is where we do a risk assessment to see, is your child very likely to get cavities, or are they on the low risk? And if they're on the high risk, we help guide you on how to reduce that risk by either changing your diet or showing you some proper brushing techniques. Believe it or not, brushing somebody else's tooth can be a little complicated. So we show you different positioning and different tricks. Some kids need different toothbrushes. So we discuss all that in the first visit. You also tend to get x-rays. Okay. The x-ray shows in between the teeth. You know how you can't see in between the teeth by looking in somebody's mouth? That's one of the purposes of x-rays. So you can see what sneaky bugs are hiding in between those teeth. The other thing is that you get a cleaning. So your dental hygienist is typically the one to do it. And they could show you those tips and tricks and those different positioning. The dental hygienist typically reviews that, Ellis.
Ellis, can I ask a question?
Sure.
How important is it to take your child to a pediatric dentist versus your family dentist that you may have seen all your life?
I love that question, Dr. Austin. How I answer that question at work is your child typically has a pediatrician, right? So why not have a pediatric dentist? Because believe it or not, the child's mouth is very different. A baby tooth or a pediatric anatomy is so different from an adult. And if your child has these needs, they have different needs than adult dentists. So if they have a mouthful of cavities, typically your adult dentist can't really manage their behavior. But if you're already established a relationship with your pediatric dentist, trust me, we'll know exactly what to do.
Yeah.
That was a fantastic question. So, along those lines, Dr. Frazier, I know we're coming out the box with you, but Dr. Austin, we're coming. We're coming around your block in a moment. What are those considerations? You talked about how there's difference. What are some of the considerations that a pediatric dentist makes versus, let's say, for an adult dentist to treat a patient?
Yeah, great question. So, one of the biggest things is children typically have an increased level of dental anxiety. And if your child is anxious about getting dental work, even one cavity is going to be really hard for that adult dentist to treat. So the one thing that we take into consideration is the amount of anxiety that they have. The second thing is the amount of cavities. If your child has more than 3, 4, 5, sometimes 10 cavities, it's going to be hard for that 4-year-old to go to the dentist 4 times and sit in that chair for 30 minutes at a time. So a lot of times when you have a lot of cavities, the pediatric dentist will actually suggest that you get your child's dental work done under something called sedation, where they actually get put to sleep. Sometimes if they have fewer cavities, we can actually get in there with nitrous oxide, which is laughing gas, which is completely safe, and we can get it done then. So the dental anxiety for the child is a lot of times different from the amount of dental anxiety for the adult. That's the major thing, is really the anxiety. I will say this: sometimes we take into consideration how long that tooth is going to be there. In an adult dentist and an adult patient, you want those teeth to last forever. In a child, sometimes if that tooth is going to fall out within a year, you can take a more conservative approach. Whereas with an adult, you want to do a more proactive approach, right? So as a pediatric dentist, sometimes we weigh our risks and the benefits of treating.
Gotcha. That's an important point, Dr. Austin. So if adult comes in and they've got anxiety, how is that treated for you, adult versus a child? Because a child is, sometimes easier to manage. They have some legitimate anxiety, but you got a grown adult in there with anxiety. What's your procedure if you have somebody that doesn't come?
Very, very similar. And the childhood anxiety usually carries over to adult anxiety. And I get that. I have patients that can't even get through a cleaning without sedation. I have very anxious clients, and a lot of times sedation isn't covered by insurance if it's IV sedation. So I have 3 methods. Number 1, Dr. Trudy Ann Frazier talked about it. The nitrous oxide, the laughing gas, is the very basic, very, very safe, and it doesn't stay in your system long at all. Number 2, we can prescribe a pill that's called Valium, and that is something that we can prescribe and you take about an hour before your dental visit, and it's going to really make you feel calm and at ease. You'll still be able to respond to command. If I ask you to open wide or any command, you can hear me and understand and act on that command, but you feel more relaxed. And then the third option is the IV sedation. We actually call in my office, an anesthesiologist, and we will put you to sleep completely, because I do a lot of makeovers and it can take like 5 hours. The work that I do is very, very time consuming. And if they're nervous, they're just not going to get through it. So the IV sedation, you can't eat for like 12 hours before. You come in, you go to sleep, and you wake up and you have your smile. And so I find that it's the option that a lot of people want. But unfortunately, a lot of times the insurance won't cover. And in New York City, it's about $900 an hour. So it can be cost prohibitive if you need a lot of dental work.
Wow. Okay. So that's great that there's options. I think that's a wonderful thing. So Dr. Frazier, what are some of the most common, you talked about cavities, but what are some of the most common kind of dental problems in children?
Great question, Alice. So actually, I will have to start back at cavities, because Alice, did you know that 42% of children ages 2 to 11 have at least one cavity? I mean, that's so many. So dental caries is one of the most preventable diseases in children. I would say another issue could be crowding. Sometimes the teeth come in and there's just not enough room in the mouth for the teeth. And that's where the orthodontist can come in. So we actually recommend that the child, especially when you see that the teeth are very crowded, sometimes it's better to send them to the orthodontist early for a free evaluation at the age of 7 to 8 years old. And now some people may think that's a little early, but as pediatric dentists, we believe in early intervention. So it's better to have an established relationship with an orthodontist before you need one. And it doesn't hurt much. The evaluation is typically free.
Mm-hmm. What about like thumb sucking as well, those habits?
Ooh, yeah.
A great question, Dr. Austin. So a lot of kids do present with either thumb sucking or tongue sucking. And what we find is that those mal habits can actually change the shape of the teeth, which can affect your smile, And it actually can also affect the way you speak, the way you articulate. So a lot of times as pediatric dentists, we do those evaluations. We actually have something called habit appliance, and we can actually break those habits before that you enter into adulthood, or even before you turn the age of 7 and you have to go to an orthodontist. Sometimes those habits are better broken early.
A habit appliance. So help us understand what that habit appliance is. It, I mean, I guess it's to stop the something.
Yes.
Is that going to prevent any other like them eating, or is it uncomfortable for the child?
So great question, Ellis. So kids are so resilient. I tend to think that kids are more resilient than us adults. So anytime you place a habit appliance in the kid's mouth, initially they have what's called a lisp. So they speak a little funny for about a week or two. But believe it or not, they adapt so quickly. And some kids hate it enough that they actually stop the habit. Now, if it's the thumb, you can train it with other methods. But when it's the tongue, that habit appliance actually has to remain between 8 months to a year, because the tongue is a little more challenging to break. That habit's a little bit more challenging to break because it's something that you do subconsciously. But we have different swallowing techniques. We have so many tips and tricks, Alice. I just recommend going to see that local pediatric dentist, and they'll definitely help you.
I have a question. What about, I've heard about the recommendation. Do you recommend the hot sauce on the thumb? Is that something that dentists actually recommend? Because it doesn't sound like a tip that a dentist would recommend, but I'm not sure. It's one of those
Oh,
things that I've heard about on the streets.
so Dr. Austin, I just love your questions. So I'm originally from Jamaica. So hot sauce, I mean, there's so many things that people recommend, but I don't recommend the hot sauce. I think it's a little cruel, but there is a product called Mavala, and it's FDA approved and it's safe. And it looks like a little nail polish that you can actually paint on the thumb. And with a Mavala and positive reinforcement, I find that I can get a kid to stop sucking their thumb within maybe 3 to 6 months. Sometimes it just depends on how how determined that child is. Now, it is harder to stop that thumb sucking habit if the child has been doing it since birth. Like when you look at the ultrasound and you see the thumb in the mouth, it is harder to break those habits. You may need a habit appliance for that, but that Mavala, and you can find it anywhere. Amazon's a great resource for that. But
Oh, wow.
no hot sauce, doc. No hot sauce.
Okay. Parents.
That sounds like something I would do. I was like, just sprinkle a little hot sauce and some cayenne on that thumb. That's not. That's not. I think ultimately there's a psychological component to thumb sucking as well, and so I think the longer that takes, that there's a soothing that comes with that, and so that's got to be replaced in some way. So we might break the habit itself, but we've also got to recognize that there's something more that we might need to do with that child. So because that's my little mental health moment, I want to talk about that. So Dr. Austin, talk to us about fluoride. That fluoride was like, nobody talked about it for a long time. It was in everything, and then all of a sudden it picked up. Somebody got some misinformation and said, oh, it's bad for you. And they're putting fluoride in the water and it's making us all, there was all this kind of, I'm not even going to say all of it because it was just misinformation out there on the internet. So help us understand what the benefits of fluoride are. Is it safe? Should we be getting, and then Dr. Fraser say, should parents be getting fluoride for their kids?
Yeah, I can't wait to hear what Dr. Fraser says. I am a fluoride advocate. It's a mineral, it strengthens the teeth, and it can actually halt those tiny cavities that are forming in the child's teeth from getting into the deeper areas and closer to the nerve. So I'm all for it. And if I am correct, I still believe that the American Dental Association is an advocate of fluoride as well. And yes, it was put in our water in, if I do believe, the late 60s, early 70s. And since then, there has been a drop of a cavity formation across the USA. So I'm an advocate for it. I understand some people feel that it's a toxic thing, but I am for it. And one of the things that with my adult patients, when they come in, I ask if I see a lot of cavities. It's one of the things that I will ask, do you drink bottled water primarily, or do you drink tap water? And usually the clients that have more cavities are the clients who don't have a intake of the fluoridated water and they drink bottled water. But listen, if you are brushing your teeth on a regular basis twice a day, you're flossing and you're watching your diet, you're not consuming a lot of sugars and acids, and you're getting rid of the plaque, hey, maybe you are not going to be so cavity prone and you don't have to worry about intaking fluoride and having it as a part of your routine. But if you find that you have a high cavity rate, every time you go to the dentist, there's a cavity, you're not brushing really well, consider it. So I respect anybody's opinion. If you're against fluoride, then make sure that you do the 4 key things that you need to do every day: brush, floss, rinse your mouth, and also clean your tongue to make sure you get all the bacteria out.
Dr. Frazier, should parents consider fluoride for their children?
Absolutely. So I'll say this, Ellis, I am not a one-size-fit-all doctor. I do respect people's opinions. So I will say this, and this is to continue from what Dr. Caswell was saying, Dr. Austin was saying, xylitol is a good alternative for fluoride. It's natural. It comes from trees, and you can actually find it in your local supermarket. Some toothpaste actually have xylitol. So that's a good alternative to the fluoride. And in terms of the fluoride contradiction, the fluoride controversy, too much of anything is bad, right? It's bad for you. So fluoride in moderation, I think, can definitely help reduce that cavity risk factor. So I would say this: for a child under 3, just a smear, just a little. In Jamaica, we say a toops of fluoride toothpaste on the toothbrush can help really reduce that child's risk of cavities. And once they hit the age of 3, or once they start to spit, you can increase that amount of toothpaste to a green pea size. That's just the little amount on the toothbrush. So it's enough that if they swallow a little bit, it's not going to cause harm. But if they spit it out, then, they get that good fluoride strengthening agent. So how fluoride works, Ellis, is that it bonds with a component in the enamel, and it forms this bond that causes the teeth to be stronger. So like Dr. Austin said, if you are really flossing, really brushing, you have a low sugar diet, low carb diet in moderation, then maybe it's okay if you don't do the fluoride. But if you really need something to help you, I think fluoride is an excellent helper.
Were you suggesting that it's the ingestion of the toothpaste that is really the problem? It's not the use of fluoride, it's
Yes.
Taking it in your system.
Absolutely, Dr. Austin. I mean, if I sit there and I swallow toothpaste, I've actually had quite a bit of parents who are more on the conservative side, which there's nothing wrong with that. I've sat down and had conversations with them about the fluoride research that's out there. And if you pin through that fluoride research with a fine-tooth comb, you'll see that a lot of that fluoride toxicity, they were ingesting it. They ingested in the mice. So if you sit there and you ingest a half a tube of toothpaste, absolutely, it's going to cause some fluoride toxicity. But using just a small amount, a grain size amount, a pea size amount on your toothbrush is enough to help you without causing harm.
And so just let's finishing up the fluoride discussion. How often should somebody, child or adult, get fluoride treatment when they go to the dentist?
That's a great question, Ellis. I recommend every 6 months, especially if you have a high caries risk. It's really individualized. It's the conversation to have with your dentist, because I know some insurances only cover it once a year. But for patients who are just really, like Dr. Austin said, every time I go, I've got a cavity, or 2 or 5, I would recommend it that twice a year, but at least once.
Dr. Austin, what are some of the kind of the main, and Dr. Frazier, you can talk about this for children, but what are some of the main kind of things that are causing tooth decay? And then we're going to talk about how tooth decay can impact our physical health. But what are those main kind of culprits that are causing tooth decay?
One of the biggest culprits is that soft, gooky stuff that forms on your teeth every single day. We call it dental plaque. And it's really the reason that we're brushing every day. And we recommend at least twice a day, in the morning and at night, that you remove it. It's nothing but bacteria. And if that bacteria, it has to eat on something, it gets hungry. And you know what it loves? It loves sugar, it loves carbs, it loves to combined with acids, and it can cause an acid attack. So it's really not removing the plaque properly. This is why we are on you guys, to make sure you're brushing a couple times a day and flossing to get below the gums. And below the gums and between the teeth is the area most of us do a pretty decent job cleaning. The visible part of our teeth. It's the flossing where most people usually blow it. And that's why I recommend these flossers on a stick. It's so easy. Before, we'd have to wrap it around and get all confused, and we just say, "Oh, to the heck with it." But now you have these, and you just grab it, and you want to clean the sides of the tooth. You want to go in a vertical up and down. You're really, while you're in there, just trying to clean the sides of the teeth so that plaque, the acid, and the sugars do not stick to your teeth and cause that slow but surely cavity between your teeth and below the gums. And so your diet, your oral hygiene habits play a big role. So watch your sugar, watch your acidic foods and beverages, and by all means, brush to get that plaque off. Anytime you see it, think that it's bacteria, it's bugs. And if you had bugs growing on any other part of your body, you'd be like, "Oh, get that off of me." Think of it like that in your mouth.
I love that, Dr. Austin. That was great. Get those sugar bugs out.
Yeah, get the sugar bugs out.
Right. So a lot of people think about candy and they say, if I reduce my candy, I can reduce my kids' cavities risk, right? But what we forget is the soft drinks, like the sodas. A major component of soda is carbonic acid. And the operative word in that is acid. I blame the marketers. If they marketed a drink and said, "This is acid, drink up," we would stay away from it, right? And they say carbonation on the sparkling water, right? Carbonated water, sparkling water. It's actually acidic. It's carbonic acid. So if you drink that over and over, you just sip on it throughout the day. Every time you take a sip, you're actually introducing that acid into your mouth. And like we learned in school, acid burns. So the same way acid burns outside of the mouth, the acid really burns down and weakens those teeth. The other things that we don't think about, Ellis, is the sticky candy. Ellis, I'll be frank, I'm not the doctor that says no candy, right? I actually encourage the kids to pick a better version of the candy, and pick stands for popcorn, ice cream, and chocolate, right? All these things dissolve, right? As opposed to the sticky candy, like the gummies, the gummy bears, the Skittles, and the Starburst. I mean, there's so many sticky versions. Those things tend to stick around in the grooves of the teeth, and then it's hard to brush back there. So then they stick and they cause cavities. The other thing that we fail to realize, Ellis, is gummy vitamins, right? I always recommend switching from a gummy vitamin to, and that's for adults too, it's not just for kids, liquid vitamin or chalky vitamins. Those old school Flintstone vitamins,
Flintstones, yeah.
They still work just as well. I just found out that Flintstone is actually making a gummy version. Stay away from the gummies.
Well, the other thing to keep in mind is we got to get on the parents too. If you have a young child that's on taking a bottle, please, parents, do not put your child to sleep with a bottle, especially if the bottle has juicy juice or milk or anything like that, other than water. When I used to work in the school in New York City, one of my first jobs, I used to be the school dentist, go in and take the kids out of the class and do their teeth. And the amount of baby bottle cavities was crazy. And like Dr. Trudy said earlier, when you have a kid that has 20 teeth that has cavities, it could be really traumatic and expensive. So we want to make sure that you guys don't put the kids to bed with a bottle.
I'll say this. I'm so glad you said that. Ellis, you were talking about that first visit. I
Mhm.
actually reiterate to the parents that if there's one thing that they take away from that first visit is stop the bottle feeding after brushing at night. If some parents, it's really hard to get in there and brush their 1-year-old's teeth or their 2-year-old's teeth. So I would say brush. And then after that, only water. So if the baby is accustomed to having something, then switch from the milk or switch from the juice to the water, right? Because there's nothing like a cavity party at night. And that's what causes cavities in 1-year-olds. Believe it or not, I feel cavities in 1-year-olds because they go to bed after brushing, then they get a bottle. So let's put that bottle of the milk before the brushing and then brush afterwards.
Hey, here's a thing that I think a lot of parents don't know. As soon as two teeth actually touch is when the child is supposed to have their teeth flossed. So flossing isn't just for adults. As soon as those two teeth come in together and they're touching, the kid should be flossing as well. So it's another skill set that the parent has to learn and the child has to learn, but we got to get those habits in early, and then it just becomes routine.
Well, I've learned so much. So if you're just joining us, we are talking to Dr. Trudy Ann Frazier and Dr. Catrice Austin about your child's mouth, the gateway to their health. And this is part of our Healthy Kids Summit that we're going to be doing. That we've already started it. So this is the second panel, well, really the third, because we had one right before this one, third panel of the day. And so we've got a couple more, but this is really fascinating. One, I feel a little shame because I do drink bottled water, so I got to make sure I get my teeth straightened out. We talked about fluoride, so please, this is a wonderful discussion. We're talking about your kids' teeth and adult teeth as well, because you're developing these habits as a child. Going to the dentist, you're developing a habit as a child. Flossing, we've talked about flossing, developing those habits as a child. Fluoride, we've talked about fluoride, but as long as we're not ingesting it, it is safe. We just can't just sit there and eat, toothpaste. I don't know who does that, but there was always that kid that ate paste in the classroom. So you might want to eat some toothpaste. It's always that. So you got to keep your eyes on that. But as long as you're not ingesting it, and I love the things, Dr. Austin, I want you to reiterate for our audience the 4 things that you said people should be doing each time.
Number one, I call it my smile workout. Number one in your workout routine that you're doing every day is you want to brush. Now, there's different levels of brushing. You can brush with a soft manual toothbrush, which we all know and love, but you can step it up with a electric toothbrush. And what I love most about the electric toothbrushes is that it has a built-in timer. We should be brushing for 2 whole minutes every single day. And what I want you guys to do is to get to that 2 minutes, you want to break your mouth into sections. It's going to be 4 sections. So upper right, upper left, lower left. And each section you want to brush for 30 seconds. And while you're in there, you want to brush the front surface, the biting surface, and make sure you get the tongue surface. That's where a lot of people miss. So brushing every day, twice a day, morning and at night before you go to bed, will save your smile. Number 2 in our smile workout is going to be that flossing. And I highly recommend that you get the flossers, and you're going to literally just go up and down in a vertical motion. Don't go zigzag. And you want to hug the tooth so that you don't injure your gums. And just get in there really quick, go up and down and clean the sides of the teeth. That way, that hidden bacteria, the hidden sugars, and all the things that are causing an odor and causing destruction of the bone, because we haven't even talked about that. Not only can this bacteria attack your teeth, it can attack your bone. And if you wonder why your teeth get loose over time and you lose them, is because we're not removing that bacteria that's below the gums. So that's super important. Number 3, we want to rinse with an effective mouthwash. As long as it doesn't have alcohol, it's going to be safe for your mouth. And here's the thing. When you're brushing, you're only really reaching about 25% of the mouth. When you rinse, you're getting a full mouth clean. So make sure that you're using an alcohol-free mouthwash, and that will give you a complete clean. And then for our people people who are worried about bad breath, or you build up plaque on your tongue as well. That's a hidden area that a lot of people don't get. You can get a tongue cleaner. Now, you can brush, it's cute. However, tongue cleaners are very, very effective. And if you stick your tongue out, sometimes you'll see after you've eaten or you had a long day, there's stuff on your tongue. It may be yellow, it may be brown, it may be the color of some of the things that you ate, but you're going to stick your tongue out without gagging and just pull forward. And when you do that, you're actually going to see the yellow brown film of plaque coming off your tongue. It's disgusting, but it's going to help you have fresher breath. And those are the 4 things that you need to do every single day for a healthier smile.
Wow, that was fantastic. That was fantastic. We didn't cut that up. Just put that on there. Let that go viral right quick. so that's great. So all right. So now we're going to pivot just a little bit because we said this is a gateway. So we've talked about how to keep that gateway clean with fluoride, the 4 steps. Dr. Frazier's done a good job of normalizing for parents and when they're talking about their children, when they should start going to the dentist. So we've got that piece out. So we cleaned out the gateway, but let's talk about those things that can happen if we don't do that gateway, right? So there has been some research that shows there is a connection between poor oral hygiene, dental decay to cardiovascular disease. Dr. Austin, could you help shine some light for our audience as to what that connection is to help them understand why it's important for their own personal health to make sure they got a clean mouth, and particularly for their children to get them started with good oral habits so they don't even run into that cardiovascular issue?
Yes, it's not only cardiovascular, it can go to your brain. Just think about your vital organs and this plaque, this bacteria. If it's not removed here, you do know that the mouth is connected to the entire body, right, guys? So you want to make sure that that bacteria does not travel through the bloodstream and get to the other vital organs, your brain. You can have a stroke, your heart, you can have a heart attack, your other kidneys and other vital organs that keep you ticking. If that bacteria gets to those areas, you can have a lot of health problems. There was a 12-year-old, I do believe his name was Diamante Driver in Maryland, and his parents didn't have a lot of money, and he needed, was it a root canal, Trudy, or an extraction?
It was an extraction.
Extraction. He needed an extraction, but his parents could not afford it. And because that tooth was not taken out, unfortunately, he lost his life because of a toothache and a extraction that could have easily been taken care of had he had access to proper dental care. So that bacteria traveled to other parts of the body, and it unfortunately, we weren't able to keep him around to have a fruitful life. So we don't want this happening to your kids. And this is why access to care is super important. And I also want our audience to know that if you have some medical conditions like diabetes, diabetics are twice as likely to have gum disease. And it can cause, if they don't control the bacteria in their mouths, it can cause, a lot of health problems in the diabetic. It can exacerbate the symptoms, and they can have severe health benefits or health problems as a result.
I have a question for you, Dr. Austin. How important is it for mothers, pregnant mothers, to keep that oral care, that oral hygiene area clean?
That is a great question. Now you coming with the good questions, Dr. It is important. It's a myth that if I am pregnant, I should avoid the dentist at all costs. And this is a myth that is not true. So we're going to bust it. When you are pregnant, you can go to the dentist still. The safer months is during the 2nd and 3rd trimester after the child's vital organs have developed. However, if you have an emergency, you need an extraction, you need a root canal or anything, you can go to the dentist. We can treat you still on an emergency basis. There are conditions called pregnancy gingivitis, where it's a special condition that's found only in pregnant women, where your gums may bleed more. In any hormonal period in a woman's life, during the menstrual time or pregnancy, you may find that you're going to bleed a lot more. So don't, ladies, if you're pregnant and you find that your mouth is changing, your gums are bleeding, don't shy away from it. Make sure that you still go to your dentist, make sure everything is okay. B, just make sure that you're taking care of your oral hygiene and minimizing the plaque, because again, we don't want that bacteria to travel through your system and get to your baby's system. So please don't skip the dentist because you are expecting a child. You should be actually going your every 6 months to make sure that you're healthy and all is well.
I'm rarely speechless, but that is fantastic not fantastic to know, but just understanding. And I think that's really important. That's why we're having this whole discussion today. We added out, I was like, there's one panel that I wanted to add. I wanted to add this dental health panel.
Thank you.
Our Healthy Kids Summit, because that's all part of it, right? This is what we put into our mouths is going to be determined. We are the summation of our habits, of what we do, and what we put into our mouth is going to come out in our health outcomes, right? So if we put a lot of sugar in, we might get diabetes out. We put a lot of salt in, we might get hypertension out. We don't take care of our teeth, we might have cardiovascular disease, strokes, other conditions. And in an extreme case, death can result as a result of not taking care of our oral hygiene. And so I want to stress that that's a tragic story that didn't have to happen. And extraction is something that can happen. It's very, and in many places it's done free of charge or no charge in some certain areas. So we have to make sure, but the first thing we have to do is we have to stress the importance, right? Your dentist, your child's dentist, whether it's pediatric, family, or otherwise, your child's dentist should be part of their health team with their pediatrician, with their doctor. If they have some mental, their psychiatrists and psychologists, all of that is part of their health team. We should make those. And hey, here's some tips. And this is for you, Dr. Frazier. What are some tips that we can do? We can help our child develop good dental hygiene habits early in life that can carry all the way through?
Yeah, great question. So the first one is firstly, let's start with ourselves as parents, right?
Right.
Let's allow the kids see us taking care of our oral health care.
That part.
Let's work on our smile workout.
Okay.
Children live what they learn. So as parents, as adults, it's imperative that we start them out on the right track. So take care of yourself, and then your child will emulate those habits, right? Secondly, let's make brushing fun. If you just say, Johnny, go brush your teeth. Mom, but I need help. Go brush your teeth. It becomes this thing that, well, mom doesn't want to help me. I don't know what I'm doing. Well, let me just try. Let's do it together. I call it teamwork brushing. Have the child, depending on the age, I would say no younger than 7 or 8. You're welcome to have them go and try, but make sure that you go behind them and help them, especially with the flossing. It's really hard to get in between those crevices and hug the teeth, like Dr. Austin says. So a 7-year-old doesn't have the manual dexterity ready to properly floss their teeth, right? So make brushing fun, lead by example. And then thirdly, reduce their sugar intake. It's so important. Ellis, believe it or not, the enamel, which is the outer portion of the tooth, is the hardest structure in our body. And what a cavity is, it's a hole. It's literally a word, a cavity, right? A hole in your mouth. So if the strongest structure in your body is breaking down, what else is breaking down within our body? What other systems are we harming by the food and the habits that we're practicing?
Hey, Dr. Frazier, whatever happened to these disclosing tablets? Do you guys remember going
Oh my goodness.
and you chew on these pink little tablets and it'll turn your teeth pink where you didn't brush really well? And I think that we need to revive the disclosing tablets.
Well, I love, Catrice, I still use them. So
thank you.
I
They're on
don't have the
Amazon.
liquid.
You
I
can get,
don't like the liquid because the liquid gets everywhere. I
yeah,
do prefer the tablets, and the ones that we like are actually produced by a company, Gum. They're super
yes,
cheap. I find them on Amazon so
yeah,
readily,
that's what
right?
they look like.
I actually recommend chewing half of them because the entire tablet actually stains the whole mouth and it's really hard to brush. But a good trick with those disclosing tablets is to have little Johnny floss and brush, right? And then have them chew up half of that tablet, spit it in a cup because I don't want you to stain your sinks pink, right? And then it'll show where it was left off. And then you as the adult can go behind them and say, look where you missed.
Right. Well, that was fantastic. That's another, y'all are dropping gems today. Okay.
Hey, you wanted to have a panel, we're gonna bring it.
Okay. So let's talk, mental health is a hot topic today, right? And so we're trying to make mental health part of every conversation, right? So we're going to normalize talking about mental health. What are those stressors? And so, and we talked about dental anxiety earlier on, but there's another type of dental anxiety, and that other type is those things that that we have some control over, but we've got to be better about, and that's like bad breath, um, discoloration if you're not brushing, if you're not brushing properly, um, if your teeth are pitched or out of line, you're crowding, all of those things. Those things can cause us. And if you have just poor oral habits and your teeth start to decay, and now you don't have your smile is now it doesn't look as good, and so you might start not smiling in pictures. You might start avoiding pictures. You might start avoiding events altogether because you don't want people to see that smile, and that can take its toll on your mental health. So how do we get people to recognize that instead of withdrawing, leaning in and starting, okay, look, my smile's not right. I need to go see Dr. Austin. You might cost too much. We may go to somebody else. I mean,
I am not that expensive. However, when I was younger, my teeth, I had multiple spaces between my teeth. They flared out, and I got called Bugs Bunny, all kinds of names, and I didn't feel confident about my smile. I was an introvert, and I thought that was just the way it was going to be. And when I got to high school, that pivotal time in your life when you want to fit in and you want to be one of the cool kids, my mom, knowing how it affected me, sacrifice. That's what mothers do. She sacrificed and got me the braces that I always wanted right at the right time, the age of 15.
right.
And I wore them for a year. And once those braces came off, man, you couldn't tell me nothing. I thought I was Beyonce, Miss America. My whole self-esteem and confidence in the way people responded to me in a different way, it just changed my life. And it's literally how I got interested in dentistry, because that life-changing experience is what made me say, I need to help people feel this, that confidence, that sexiness, that it's an attraction. It's one of the first things that people will notice about you is
Right.
your smile. So when I go to work every day, and when I'm doing my videos on social media, I'm trying to express how it's not just about teeth, it's about your confidence, your self-esteem. People are dating, you're going job interviews, so many different ways that it can impact your overall well-being and your social life and mental health. And we can't hide behind the mask. Some people got away with it for like 2 years. The mask was a little shield, but now we're dropping the mask and it's time to smile again. And it definitely, I get a lot of letters and DMs from people who don't go out, who literally stay up at night just dreaming of a new smile. And sometimes you're right, the money can be a barrier. And I want people to know that there are resources out there. There are charities, Mission of Mercy, this all across the United States. They have free dental days, free. All you got to do is get your butt up and be there at like 5 o'clock in the morning, and they will take care of your dental needs. The next resources are dental schools. You can go to your local dental school if you're in a major city that has one, and they are a great resource to get quality care at a discounted price. I actually got some of my recent dental work at a dental NYU. Even Dr. Austin went to NYU. So anybody can go at any income level. And then there's discount plans. If you want to see a private dentist and you want to save money, we're going to share a resource, hopefully, right, Ellis, to take advantage of a discount plan that's like $8.95 a month for you and your family of 4 for nationwide dentists, and you can get a discount on all the things, including braces, veneers, root canals, anything that you need. You can get that quality care, but at a discounted rate, and it is no strings attached. It's literally $8.95 a month. So yeah, it's very important, and I understand the power of a smile because I was once a patient and child that didn't feel confident.
Mm-hmm. I love that reference to the dental school, Dr. Austin. I actually lecture at Meharry Medical in Nashville. And believe it or not, though it's a school, I've seen some of the best dental treatment that's actually come out of a dental school because the students are very well trained and the professors have to check every single step. So
Right.
you are getting top notch. So don't be afraid. Overcome that fear. Tell yourself, you know what? By avoiding this, it's actually going to get worse. By waiting until something hurts, or it's only going to get worse. Let's start there. And by waiting until it gets worse, your anxiety level is going to increase and your pockets are going to decrease. So I'm sorry. So attack it. Don't shy away from what's scaring you. Find a dentist that makes you comfortable.
Yeah.
You have options. I would say one of the biggest takeaway from today is there are options, Ellis. Talk to your dentist. And if you're not comfortable talking to that dentist, get a second opinion because
Yeah.
you want to go to a dentist that makes you feel comfortable because out of that comfort, you will become more confident.
And what I love about the dental schools as well, they're usually the first to try out technology. They
Yep.
also, it's like a one-stop shop. So, hey, if you need a tooth pulled, you need gum surgery, they have departments for that. So, in that one house, you can get most of your needs taken care of. And some dental schools actually have licensed doctors that practice at the dental school. So,
Right.
you can sometimes not only get a student, you can get a actual licensed dentist. So, check it out.
I'm gonna break it down for y'all real quick. I'm gonna give y'all some context. Typically, the people that made it into dental school are the high achievers, and they don't want to be. They're going to want to do a good job every single time. So
Yeah.
even though they're in dental school, they haven't quite got the DDS and alphabet soup after their name. They're going to want, they're such a high achiever that they're going to want to do a great job and maybe try to do a better job than the people that's teaching them how to do
Mhm.
it. So you could get some great work done at a dental school. And one of the audience members said that as well. So last question as we are going to get y'all out of here. This has been this really fascinating and it's just a
Yeah.
fun hour. We have learned so much from Dr. Austin and Dr. Frazier. This has been fantastic. So what are those last tips? Give your parents that last push, that last understanding of why it's important to include dental care early in life and make it part of their self-care and healthcare routine. We'll start with you, Dr. Frazier.
Great. Thank you, Alice. So I think it's so important to start with your dentist. Start early with your dentist because whatever that child learns, it follows them into adulthoods. And the mouth is the gateway to your body. So a lot of times disease can be caught earlier on in your mouth and then it wouldn't show up for a year or two later in the rest of your body. So it's so important. As dentists, we're not just doctors of the mouth. We have a doctorate on purpose. We actually understand the connection and we can actually help diagnose those diseases early. You want your child to start early because you don't want them to be afraid. You want them to build those healthy habits and start that routine early.
I don't know how I can follow that, but just going back to what I said, your smile in every phase of your life is going to help you make a good first impression, going to give you the confidence, going to make you feel sexy, and it's like your business card, your greeting card, your come hither card. It is so important to your overall well-being in your life. And studies have shown that people with beautiful, presentable, healthy smiles are perceived to be more successful, more wealthy, and you're going to make a killer first impression no matter what you do. So think about that and what you want for your child, and start those habits early so that when they get to high school and college and they go on to their adulthood life, that they are feeling like $1,000,000, and it's because of their smile.
Well, that was fantastic. I want to thank both of you. So if you want to, I put their social media handles while they were giving their last statement. So you can find Dr. Frazier on social media at TinyToothDoc. And then you can also find Dr. Austin on social media at Dr. Catrice Austin. The fantastic VIP smiles. I also put in the comment section where you can get that discount dental service. And so I'm going to close this out with one quick story. Growing up, I didn't have a terrible smile, but I had, my teeth were not the straightest and had some challenges. I never really liked my smile. So I and people would always get on me when we would take pictures. They're like, wow, you never smile. I didn't like my teeth. I just didn't think they were attractive. So finally, as I became an adult, I said, you know what, I'm gonna do something about it. Went and got Invisalign. I had a chipped tooth, got that fixed, and started smiling. And I remember the first time I was standing with some friends. We were in a restaurant, and somebody stopped and said, you have a really nice smile. And that's the confidence that came from just that moment of that not really being happy, and to see somebody see your smile and say and compliment. Yeah. It meant the world to me. It really did. And so
priceless, that feeling.
That feeling right there is something that you cannot. And your child, it will help your child. And so if they're not happy, if they're not really happy with their smile, and for whatever reason, work with them, talk to them. Don't just, talk to them, have some real conversations, but do what you can to help them, because that really is a confidence booster, and it can impact everything else in their life. So
my mom, thank you, Mom. She changed my life. She really did.
Life changes. And so you changed Cardi B whole life. Okay. So, thank you both. Thank you all for joining us. We got one more show. Our next show is about child vision. This is Child Vision Health Month. So we're going to be talking about your child's eyesight next. And then finally, our last program is going to be about building a health team for your child. And so stick with us. Healthy Kids Summit is going on. Thank you, Dr. Frazier, Dr. Austin. If you're in the Atlanta area, go to Pediatric Dentistry at Vinings, Dr. Bates and Dr. Frazier. They will take care of you. If you're in New York or in Flint, go to VIP Smiles with Dr. Austin, and they will take care of you. So with that, we'll say good night, and we'll talk to you all later.
Bye.